So think about from your hip to your knee, come halfway, come to the lateral side of your leg, push in the middle, you kind of go, ooh. That's gallbladder 31. If you want to press in it for about 5 seconds, let it go. Press back in, let it go. Press back in, let it go. Do this about 4 or 5 times. Okay. This rules the tendons and the ligaments. This helps. So if you've got any pain in your leg or in your knees or tightness down here, this is going to be a very, very sensitive spot. Okay. Now for knees. Yeah, I've got my crazy comfort pants on. Oh my God. Okay.
Get your Mansford on to be easy.
Don't make me. Okay, so looking at your knees, okay, find your kneecap, trace it around and down, and then come off the bone. In other words, you're not on the femur or the knee, you're actually down on the tibia and the fibula. Okay, so you're beneath the knee. Come off the bone, and on the inside, on the medial portion of that, if you roll off the bone, you're going to find this really sensitive area. This is spleen 9. And if you come off the bone on the right side, this is stomach 36. Right now, mine are very sore because all those muscles that are there, your tibialis anterior, we've been cranking them. So basically, just take your thumb and your forefinger
And hurt them.
and dig your thumb into the spleen 9. Again, dig your thumb on the medial, right off the bone, okay, right here. Dig them off the bone, and you're gonna find these like really sensitive areas. Just grab them. Again, 4 or 5 seconds. Let them go. 4 or 5 seconds. Let them go.
The medial one is the spleen.
Yep, this is spleen 9, this is stomach 36. These are also good points to grab first thing in the morning. They help with digestion, with transformation and transportation of fluids. Okay. Now, let me teach you bladder 40. Bladder 40 is basically in the middle of the knee, behind the knee. It's in the middle of the crease. Okay, so what you can do is think, okay, here are my thumbs, here's the middle of my knee, and then reach in, and it's usually, right now, mine's tender. It's bladder 40. So again, any kind of knee pain, give this a crank. And I'm releasing the tension in my leg. I'm actually pulling my leg up with my 2 fingers. I'm using my 2 middle fingers. You want to go nuts? Grab spleen 9, stomach 36, do them all the time. Whoa! Light you up like a Christmas tree. Okay? Don't forget to do the other side. Okay? You always want to do things unilaterally, bilateral. Not unit, bi.
Traditionally, we start on the left and move to the right.
Yes. Okay. Now, if you come on the medial portion, find the middle of your kneecap, come over, and come off into this big meaty part of the medial section. If you dig in the middle of there, you're going to find a sensitive area. Okay?
Is it on the 5 muscle?
Yeah. Again, these are good points.
That's the demo point, isn't it?
Yeah. Not in the middle of the quad. Think follow the middle of the knee and just fall into this big hole, and you dig around in there, you go, ah!
Found that one easy.
What's that point called?
This one, this is liver. This is a liver point. Okay. This is liver 9. Liver 8 is actually under here. It's between these 2 tendons. But usually the tendons, they're not so painful, but you come up around it. Okay, and that muscle, that big muscle belly right there, that those tendons are pulling and pushing, it gets sore.
Yeah.
Okay, so again, come down off the bone. Lateral side, right off the bone, 1 finger. Medial side, come right off the bone and come as high as you can and dig around. You'll find it. Okay, these points aren't little, about the size of a quarter. Okay, and just find the most sensitive points and push in on it. Okay. You can also take your fingers and find the eyes of your knee. Now the eyes of your knee, if you come around the kneecap and just come down, you're going to find like these squishy little holes. Push your fingers in there. Okay. You can massage that. What you can also do is take all the pressure off your knee, take your kneecap in your hands.
Patella, Dick?
Yeah, like a little patella massage.
Don't push down when you do that.
Yeah.
Just wiggle it, slide it. don't
Just
push
wiggle it
down.
very gently. Just range of motion. Okay, so gallbladder 34, again, midway down the leg, on the middle of the IT band. You can hit it. You can take your thumbs. You can take a phoenix eye fist. Okay.
Yeah.
You can even take a ballpoint pen. Don't, not the sharp part, but just the blunt part. Put the cap on, and you can do any of these points with a little blunt object. Okay, not a sharp object. You don't want to pierce yourself.
Especially on your friends.
Yeah. Or if you come visit me, I'll stick needles in you. Okay. So this is basically, you've got gallbladder 34, okay, stomach 36, spleen 9. These are called the calf's nose, the eyes of the knee, Shia, because it looks like the nose of a calf, you know, I think. Or maybe they smell like it, I don't know, something like that. Okay. Number 9, number 8,